Now, in the case of children, many children first speak their mother's tongue, their native tongue, right? So,
Yeah.
how are you set up in terms of welcoming these patients from all over the world? Do you use external interpreters, or do you have multilingual healthcare professionals themselves?
So what's unique about Los Angeles compared to most other places in the United States is one of the most diverse, linguistically and ethnically diverse places in the country, which means that our local population, the ones from Los Angeles County that come visit us, they are some of the most diverse patients in America. So we already have to navigate and make sure that we are doing patient-centered care for them, using technology, using interpreters. So we have interpreters, we have video interpreters and in-person interpreters, and we leverage the latest artificial intelligence tools to make sure that patients are leaving the hospital, leaving the clinic with tools that are translated into the language that they speak. It's really important to make sure that when they go home, when they work with their local pediatricians and doctors in their home country, that they have the information, the languages that everybody can understand.
Perfect. Yeah, I mean, certainly there's let's call it a geographic advantage that you might have. And would you say this also applies to the field of innovation, your specific field, when it comes to being in the United States?
It does. There was a project a few years ago, a research study that one of our innovative researchers did. He was validating a technology tool that was evaluating dermatological conditions in children. But the technology was developed in Australia, where for the most part, children are of a very specific skin tone. In Los Angeles, we have access to kids from all over the world and ethnicities from all over the world. And so from a skin tone standpoint, his research was able to create so much rich diversity in the artificial intelligence tool that the technology in Australia was not able to do. So that collaboration was really helpful. There's so many other examples, innovation-wise, where having a linguistically, ethnically, religious diversity in our community creates so much value from an innovation standpoint. And if you're interested, we have a weekly podcast we host, which is focused on pediatric innovation. So it's called A Dose of Optimism. It's available where all podcasts are available.